Second Vibrant Health. It's Dr. Rachel Northern here in my office. So I apologize. Actually, we had just a crazy day. I am human, folks. I had some meetings that went behind, so I'm starting a little late on this talk. So thank you for your graciousness of me starting this talk a little later than I anticipated, but I'm here. We're talking about optimizing pregnancy today, and this is really a topic that's really I'm passionate about. I did have natural, we call natural vaginal births with a midwife with both my kids. They're 24 and 23 at this point in time. And thank God I was in chiropractic college at the time, and I got adjusted regularly because it did just make me feel better and got me prepped for making my pelvic floor balancing, and I'm just very blessed that I had that experience. And I want other women to have healthy, comfortable pregnancies. I mean, we can't get around the weights and all the things that go with pregnancy, but if we can give you a better quality of life through pregnancy and overall better experience for labor and delivery and then post-labor, that's what is a great thing to have. So this is a couple things we're going to talk about. But first off, preconception care. So a lot of patients are thinking about like fertility, or maybe some people are struggling with infertility right now. They don't think about chiropractic and how that can help them. So we're going to talk a little bit about that. And then just overall, getting care while you're pregnant. So first off, what is chiropractic? Like what are we doing? And we just ultimately are making sure the nervous system is optimally functioning, making sure everything's communicating through your spine, your brain, your spinal cord, your nerves. They control everything in our body. So even that's related to when you're getting pregnant. So there is some studies possibly suggesting that if you have even your pelvis is off or your low back, those sacral nerves go to your fallopian tubes. They go to your ovaries. And if there's miscommunication there, that could be indicative of decreasing your fertility chances. And same with men. It might be, if they're not getting communication to their testes, maybe they aren't producing adequate sperm because of that. So making sure we're getting that communication optimally functioning. Also, some of the nutritional benefits we talk about as well that can help, making sure you're getting some, we'll talk about it a little later, actually, I'll get into that. We're going to talk about the nutrition, like I just said, exercise, some certain things you can do while you're pregnant that is really good at optimizing that. And then, like how to choose like your wellness health providers. So, why chiropractic before and during pregnancy, I just kind of said, make sure you're optimally functioning, and like I prefer to get you before you even are pregnant so we can make sure we're balancing that pelvis before you even add the extra weight of the baby growing in you. The reason for that is if you had an injury and you already get distortion, that will get exponentially worse as you add weight with the pregnancy. So I have a lot of patients, unfortunately, they'll come in maybe 20 weeks in, 25 weeks in, and they're starting to have like the leg pain or discomfort or the back, and I come to find out it's just an old distortion they've had, subluxation we call it, and now it's getting, the extra stress on the body is making it express, and it's harder for me to balance. We can get pretty close to balancing that pelvis, but if there's already a preconception distortion, it's going to be a little bit harder because when you're pregnant, you release a hormone called relaxin to help the body, the pelvis spread, getting ready for delivery, and it's going to be a little less unstable of the body, so it's harder to get that more correction in. So it's easier to do it before the hormones start acting. So, we're talking about, making sure that pelvis is alignment, the sacrum is in alignment with that. So we do have both sides of our pelvis and that triangle piece in the back here, that those are three different units. Everybody thinks of the pelvis as maybe a solid one piece, but it's actually three different pieces. So we want to make sure that that pelvis is right where it needs to be. Making sure that communication in the nervous system we talked about. And then also if you're starting early enough, we can maybe prevent having some of the low back, sciatic pain, things that some think is just part of pregnancy. Also, a lot of times I'll have patients come in because they're getting like numbness in the hands, because as your pressure builds up here in your abdomen, it pushes pressure up into your thoracic outlet, we call it, and that can cause some numbness and tingling in the hands, but if we can get that balanced, it can reduce those kind of swelling, tingling, numbness in the hands and feet. So what are some benefits? You know, you're feeling good, like I said, as best as possible through the entire pregnancy. It helps with the baby getting in a fetal proper position. A lot of times patients come in, like I said, in that mid-pregnancy, or sometimes I get people like the 6 weeks before they're due because they say the baby's breached or not in proper position, and they read online that chiropractic can help. And yes, we can try to help balance that pelvis at that time. It takes a little bit more work to do that and to balance it, like I said. So the earlier the better to get in for chiropractic care, so we can just make sure we can start off and get everything moving better sooner, more preventatively. There is a couple studies now saying we're shortening labor times by being under chiropractic care. So some studies said even up to 3 hours, and that doesn't seem like much, but when you're in pain and delivering a baby, that 3 hours, 3 less hours of pain is pretty significant. So there's some research there. And let me get this back on track. Okay. So the one thing, benefits of the Webster technique, so I am certified, I just got recertified. It's called the Webster technique. It's a chiropractic technique. It's been around, I don't know, 20 years or so. And what it is it's a special technique that we are taught to try to help make sure we're balancing that pelvis, so then the baby can come into proper fetal position. So there's a lot of space going on. I'm having one of those days today. So it's a very specific chiropractic analysis and judgment. It reduces the interference, like I talked about the sacral nerves that go in and they go to the uterus. So the uterus that has to contract. So we want to make sure we have symmetrical contractions when labor time is happening. We want to make sure that we have the ligaments also and muscles, pelvic muscles that are in proper balance. So everything's going properly. I don't know why mouse is being good today. What happens is as we balance those things, it decreases the uterine constraint. The stress on the uterus, and lets best proper positioning for the baby. So we don't do anything with the baby. It's nothing. We don't turn babies. What we're actually doing is helping the mom's pelvis have a proper position for the baby, so the baby can be more comfortable to go head down as it should be before delivery. So usually, like if we start in the beginning, if people are coming in for prevention, everyone gets a specialized evaluation history exam, so we can find out how much they're subluxated. I do surface EMG scans to see what's going on in your muscle tone balance along your spine. We do thermal scans. We do a lot of things to see where and how much you are out of alignment or subluxated. And then I usually do custom care plans according to that. But for the most part, if people are doing fairly well, then I generally say every twice a month to come in, early stages, and then as we get closer to, as the baby grows and mama gets bigger, we like to see a little bit closer in time. So usually twice a month kind of in the beginning, depending on the case, and then as definitely that last month, we want to see once a week, just like they're going into the OB or the midwife once a week to just monitor things as it gets closer to go time. So what's nice about what I do is it's very safe and it's very gentle. I'm not doing this crazy twisting, cracking moves, especially with the techniques I use. I use more activator, the instrument adjusting, very gentle. I also use like more trigger point work, and the Webster technique is also very gentle, and it's more about just holding trigger points and adjusting properly that way. We also, what's good about what I love, and my second passion is nutrition. So we're always going to talk about, exercise, nutrition, like those lifestyle things that can also make the pregnancy better. So I have a lot of times I'm recommending magnesium. Everybody should be doing vitamin D, especially here in the Midwest. We're notoriously known for vitamin D deficiency. So those are really good things to make sure we're supplementing on that. A lot of things, there's the past of talking about folic folic acid supplementation, and we've gotten a little too far over folinating people or folic acid supplementing. So I actually kind of cut back my recommendations on that because there's some possible stresses that's actually causing, because I think we're doing it too much, and there's a lot of synthetic folic acid that's causing problems on people. So that's something we can talk to on an individual basis, but definitely do some research before you start supplementing extra folic acid, because we're finding some maybe possible problems with that. So we already talked about like our visits, what we do with the mamas. Like I said, one thing lifestyle, start trying to keep a track of your food intake. I know mamas get busy, and just making sure you're trying to eat for that two, and not eat like more than you need to for two. What I'm talking about is making healthy choices for what you're eating, because whatever you're eating, the baby's getting too, and they need those healthy nutrients. I'm very blessed because, like I said, I was in chiropractic college for both my pregnancies. I had my son halfway through chiropractic college, my daughter towards the end of chiropractic college, and when I was first pregnant with my son, I was taking nutrition classes at the same time in my curriculum. And so everything the teacher was talking about of all these healthy things, I was like absorbed, and I totally switched. Like white bread went out the door, sodas went out the door, all these unhealthy things I didn't even think about. It was just part of our standard American diet. I changed a lot of things, brought more spinach lettuce in, got rid of the iceberg lettuce that wasn't really got that nutrient dense. So I did a lot of changes at that point in time. It's eating for two, getting more variety, eating more colors, getting those different fruits and vegetables that sometimes I didn't even know these different vegetables existed, and so experimenting. So this is a good time to do that in your life, to just kind of reach out and try healthy alternatives. Main thing too, avoid the toxins. Try to get rid of any of those candles or that have toxic stuff. Any hair, maybe skincare products. Maybe evaluate everything you put in your skin gets absorbed into your body, and that could possibly go into to the baby. They found a lot of toxins in cord blood, so we don't want to eliminate as much as possible as you can. Obviously, you should know not to smoke or do vaping. That's not healthy. So whatever we put into our body. Also, nowadays they do have, sometimes they're trying to recommend vaccinations for pregnant mamas. I would just say, hey, give me research on if this is safe and effective for my baby before I want to do this. So you have to be your own advocate and do your own research. Unfortunately, there's a lot of propaganda and I say big pharma out there that's making a lot of money on these things, and you want to make sure that what's right for you and what's right for your body, and not just like some protocol that's been thrown out there. You need to do your research. So if it's saying it's safe and it's effective and they have the data on it, then that's your choice to do those, follow through those things. Or maybe you have certain health compromises and you need certain things. So the same thing, be your advocate, do your education. Like I talked about, like you can do, journaling, not for like paying attention to what you eat. If you write it down, you're more likely to pay attention to it. Or nowadays we have plenty of apps out there. Put it in the app. Sometimes now I've heard you got an app, you can just take a picture of your plate and it'll tell you how much fiber you're eating, how much sugar you're eating. It's pretty crazy. Actually, I met with my pastor, and he took a couple months ago, and he told me about this app, and I was like, that's really cool. He just takes a picture and it does all the calculating for him. So that's really cool. Making sure, again, reading the labels and trying to avoid any of the artificial sweeteners, artificial coloring, any of that kind of stuff. Try to keep out of your diet. Caffeine too, this is time really to minimize that. I mean, it depends on the client. I've been doing a lot more of DNA evaluations, and there are some people, I'm one of those people that don't really process caffeine very well. So I've noticed just from years' experience, I avoid caffeine as much as possible. I can do tea, but I can't do coffee. So again, that's something you need to consider. If you know caffeine makes you kind of not that healthy, then try to just cut that back and eliminate it if possible. We talked about the artificial sweeteners and the sodas, the high fructose corn sugar, the refined things. Try to eat more whole foods. Obviously, packaging. Everybody knows about trans fats now, so try to be more of your omega-3s, your fish oil, your flaxseed oil, all those more healthier, natural oils. Try to avoid any of those seed oils because those are kind of being rancid and they're not so good on the body. So also do more olive oil, avocado oils. Those are things that are really good for you. So water. This is one big one too. Keep track of this too. This is another thing that's good for journaling. I have a lot of women, they're just, right now, most women that are pregnant are working and then they don't want to get up, and especially towards the end when their bladders like got so much room, only little room, they kind of cut back on the water. Hydration is really important, so just try to keep up on it. If you just have one of those jars or whatever, get one of those things, coolers, whatever, with the straw. They say apparently research said if you have a straw, you drink more, like 20% more, 10 to 20% more. So try to maybe have one of those things with a straw and just sip through the day. So, I already talked about fruits and vegetables, also seeds and nuts. That's really good overall nutrients on that. I'm a big fan of like walnuts if you like them. Those are rich in omega-3s. The almonds are good with your fats and protein. And the pumpkin seeds are really good with magnesium and zinc. So it's just a variety of different things. Make your own trail mix would be helpful. They talk about just maybe eat smaller meals, because again, your stomach's probably getting shrinking as you go older, as you get bigger and further along in the pregnancy. Again, taking those more whole food vitamins and prenatals. And what's going on with your activity? Are you sitting a lot, especially if you've got a desk job? Making sure you're getting up, or you have a sit-stand desk. We're talking about evaluating, like, are you sitting on an exercise ball? I recommend sitting on an exercise ball at your desk. That's really good for the pelvis and trying to make sure you're moving that pelvis better and getting some activity in that pelvis, especially as you're pregnant. And like I said, just sit-stand desk. Nowadays, sometimes even employers, if you're working from home, will actually reimburse you for a sit-stand desk. So throw that out there if you work from home. What's going on with the activities you're doing? Do you garden a lot? Is there certain things that might put you in a bad place in your structure, especially repetitive? Or you have little ones. So I have a lot of patients come in and they got a 2-year-old and they're pregnant and they're hopping that 2-year-old still on their hip and doing this uneven. So I'm always like, okay, the 2-year-old can walk now. They're pretty good on their own 2 feet. Try to avoid picking up or have dad carry them if they want to do that. Try to do that, or just do more kneeling down and getting on their level instead of picking them up and carrying around. I know it's hard, moms. We just want to get stuff done, and so we just carry them along. But it's not really good when you get that loosey-goosey pelvis happening. Another good thing is stationary bike would be really good to do. Water is really great. Water aerobics. If you have a gym you can go to and do water exercises, try to keep up and walk as much as you can. And then there's a couple more specific things for pregnancy. There's called dynamic body balancing, and also mile circuit and spinning babies. Spinning babies has been popular for about 10 years now. That's where we do some inversion exercises to make sure to try to give the baby some room, so if it needs to try to get that head down. So all those, make sure you're paying attention to you and, review it with your doctors to make sure it's safe for you if there's things like that you want to do. So, and, yoga is always good. I was like that. I used to have a yoga book. I'd loan out a pregnancy yoga book for certain positions. So there's certain positions that are really good for pregnancy. So look that up. We have also building a team. So do you have a provider that wants to go along with your birth plan, or are they kind of just gonna do what they're gonna do? So see if they're willing to work with you on what you want to do. If you want to do more natural or not, make sure they want to work with you. Doulas are, and we'll talk about that in a second. What a doula is, if you don't know, chiropractors. And then I throw in lactation consultant. People most of the time don't think about lactation until after the baby's born, but now I'm not working with a lactation consultant, and she said actually it's better to kind of talk to them beforehand, because then they can give you some tips and tricks before you're in the hospital and trying to get a baby to latch on, and then it's like you're having frustration and have no tools. So if you actually meet with them ahead of time, they can give you some ideas of what to look for and how to do things and how to hold baby maybe different ways. And also, if you're usually buying your breast pumps at that point in time, she'll help you, show you how to measure to get the proper phalanges, I think they're called, the funiculars or something. They're called something different. I keep forgetting the names of them because that's not my specialty. But each breast can be a different size. We're not all one size fits all too. And so she can help you with that. So definitely reach out to, there's a lot of those lactation consultants in the area, and you can just pretty much Google and they'll have a bunch come up. So that's something important. And then just make sure you have like a questions for when you go in to talk to your midwife or obstetrician, so that you know that they are on track with what your desires are. Now, if you want to I have a lot of patients that want to avoid C-section. Most people that come into the office are more holistic minded, and they're wanting to avoid that. So we can have some discussions on what that is. And obviously, no matter what, we want a healthy baby. We want a healthy baby at the end of the experience. So I have a lot of guilt. Mom feels bad with it, like they failed somehow. It's like, no, we just, no matter what happens, try to do for the best outcome. But whatever happens at the end, as long as everybody's healthy and happy at the end of it, that's what we want. And then at the end, I can help with, adjusting the pelvis to make sure it gets back in place after all the trauma of the birth happens. But if you want non-invasive, that's great, but doing the procedures with us will help guide you more to non-invasive procedures. And then let's talk about what a doula. So a doula stays with you during the whole time, during labor process. So a lot of times if you're dealing with mostly the obstetrician, they might come in at the end and catch and leave. They might be the last hour or maybe 30 minutes. Where the doula is there from once you start those contractions regular, they'll be with you the whole time. They'll give you that emotional support. They're an extra person to help. Yes, you want your significant other involved, but this is an actual great person because they're really knowledgeable of certain things and help keep that other person calm, because sometimes they start to freak out. So it's really good to have somebody, and they also know what your intentions are. They'll fight and advocate for you. When you're going through that process, it's too hard to make analytical decisions, so they will help you and be your advocate. So they just facilitate with your practitioner and keep everything a little bit more on the way that you actually want things to go. So if you want that experience, then there's plenty of doulas you can reach out to, and you can let us know. We have a couple on our referral list. So here's the top 10 steps for that healthy optimizing pregnancy. Begin at the beginning. First start off before you're even pregnant. It's better to prepare knowing that most pregnancies are not discovered until 6 to 8 weeks. So it's better just to we get you started right in the beginning, and then 6 to 4 start making some of those lifestyle changes now. Let's try to convert some of that. Because right now it's the beginning of the year here, so those New Year's intentions, it's a good time to start shifting and looking at what is good for your daily wellness versus just what's a trend, and trying to do those micro changes. And one book I love is Atomic Habits, that really does help you, gear you up to help yourself get geared to make long-standing lifetime changes. 3, get adjusted from the beginning, so making sure that just kind of helps give that quality of life from the get-go. Let's see, 2, turn that into a lifestyle too, and making sure we can get it through your pregnancy and then even post-pregnancy. I have one particular patient, I've seen her before she's been with me for many years. She's been, I had her when she was single, and then she got married, then she had the first child, then she had the second child, she had the third child, and the whole family comes in, a lot of times together. Sometimes the dad comes around, he works depending on work. But we talked about how she had great pregnancies, great labors, great deliveries, and everything else, and she really does contribute chiropractic to helping her for that. So, and then she does a lot of the nutrition with us, and so she is a big advocate that this is definitely part of that health optimizing wellness lifestyle. So the first adjustment, the most gentle and power adjustment is, a blank. So with that being said, when I have a patient go through, all the way to delivery, I always offer a complimentary check on the baby after that first week to bring them in and just let me check them and make sure that there isn't subluxation so they can have that best quality of life that they possibly can have and make sure there's no nervous system interference or subluxation. So I always offer that's like my gift to make sure that baby starts off fresh in life. So optimal. So how to get involved, you can text our office 815-344-0113. You can look us up online. It is The Doctor and You, all the words spelled out, is our website. And thanks for joining us today.